Morning, Monday again. Can't believe these weeks are flying by. Yeah, welcome. I've made this episode public today, so hopefully it's a good one. And yeah, just to give people a bit of an insight into what we do. So yeah, we put it live, well, the live stream on our YouTube page and or YouTube channel, and on our Facebook group as well, Movement Therapy Education. So feel free to share this if you find it useful. And also for the next, I think it's till the end of July, we're running this competition, and mentioned it last week. We're giving away a free place on a level 3 sports massage course. It's one that we have put together, so it's got a lot of new information in there. Well, kind of newish, and it's all about the how manual therapy works, the science behind touch, what we can do to help with pain, and what pain is as far as we understand. So it's one of the most up-to-date level 3 courses that you can get out there. So yeah, feel free to share this if you think that people might find it useful. People on the course as well, they also get access to this, to Learn Anatomy Online. And so this is the kind of thing we do every Monday at 10 o'clock. And we have just finished off the lumbar spine. So we looked at the lumbar region, and morning, Neil. We went through the anatomy of the vertebra. So there, had a look at that. So that's a lumbar vertebra just there. So first of all, we went through all that. We went through the bony anatomy, and then all of the passive structures, so the discs and the ligaments. Then we started to look at the active structures. So we looked at all the muscles. Then we had a look at the nerve supply. We've done the blood supply to that region. And we've also had a look at discs and disc herniations in quite a lot of detail as well. So for depending on which course you're on, whether if you're on a level 3, then the bony anatomy and the muscles is really important. If you're doing those higher level courses, level 5 up to degree level, then the neuroanatomy, the anatomy of the discs, and the blood supply is obviously really important. So yeah, it gives you a few more things to think about when some people come in with symptoms. So we're going to now have a look at this region. So this is a thoracic vertebra, and if you have a look at the difference between the two, so we're going to be discussing the differences and how those differences affect the way you move, and the kind of the issues that you would have in that area, because the lumbar vertebra is obviously, morning Julie, lumbar vertebra is obviously very different in structure. There's a lot more load going through that lumbar spine, so there are some typical pathologies around that area, so basically things that can go wrong within the thoracics, as you'll see when we get to have a look at the structure. The likelihood of those kind of pathologies is a lot less, so much less likely to get things like disc herniations. But then there are some other injuries that may occur in that area because of the shape and the structure and the kind of things that we do with that part of the body. So yeah, we're going to start from the beginning again. A little bit more detail than last time. So this is episode 84. And the last time we did the thoracics was on about episode 17, I think. So, yeah, quite a while ago now. Thank you very much, Becky. Thank you. Yeah, so in fact, I better put these, I'll put that one up, definitely. Okay, just make sure people can read that on the if they're watching it back. Thank you very much. Yeah, and that's coming from someone who's a very experienced therapist. So thank you, Becky. I think you never really stop learning with this stuff, and I've said a few times where putting these sessions together, it takes me, depending on the session, it takes me anywhere between sort of two and 3 hours to put together each week. So yeah, there's even for me, there's some things where I go, oh, I'd forgotten about that. And yeah, you kind of pick up bits even if you've done anatomy before. And if you're brand new to anatomy, the great thing is you can watch these back. So let's get going. So we're going to have a look at the thoracic spine and a little bit of an introduction to the ribs. So that's if we get there. So hopefully we will. And yeah, we've got a little bit on the whole thorax basically, so the sternum and the ribs and how it all links together. So hopefully we'll do it in one session. May take a couple of sessions to get through. But so first thing we're going to have a look at is the is some key terminology. I'm just going to switch my screen a second. Just move that so I don't squash any text. There we go. Get me up there out of the way. Cool. So yeah, the key terminology. If you've never done this kind of thing before, then we've got some things to look out for because we're going to introduce you to some new words. So costal, you might have heard of something called intercostals. Basically, a costal is a rib. That's an old term for a rib. TX, if you ever see that in my presentation, and often you can write this in notes as well. It's a shorthand version for thoracic vertebra. So TX, you can just put in your notes as thoracics. Morning, Penny. Morning. In osteo, so that's my background as an osteopath. We used to put TSP. But that always reminded me of so thoracic spine, SP, but it's like teaspoon. So so I prefer the shorthand that the physios tend to use, which is TX. That's who I picked it up from. And then facets. So facet joints. If you've not heard of those before, we're going to have a look at some of those. We've looked at those in the lumbar spine. It's where the vertebrae join together are the facet joints. Their proper name or the proper term is zygapophyseal joints. So we'll just stick with facets. The facet basically means little face. And they're called that because they're very, very smooth joints. And you'll see that when and they're different shape in different parts of the vertebra. So we've had a look at the orientation in the lumbars. We're now going to have a look at the thoracics and the shape of those. Transverse process basically means side sticky out bit. So we'll have a look at these on a picture in a second. But if I just make this image a bit bigger, there we go. So the side sticky out bits are these ones. Okay, so these are transverse processes, and then spinous process, which is that one, is that one. Okay, so that's a spinous process. So this is the spine sticky out bit. So if you're feeling on the back of someone's back, and you can feel those bumps on their spine, those are the bits you're feeling, is those spinous processes there. And then pedicle means little feet. So the vertebral body is this bit here, and then coming off of your body are little feet, which are the joins in between the transverse processes and the vertebral body. So that bit just in there. So just a little bit of a heads up with some terminology that we're going to use today, so that you have got a bit clearer understanding of what that is if you've never heard of it before. So we've had a look at this before, the functions of the spine. What the spine actually does. We looked at this in the lumbar region. There are some key differences with the thoracics, and we'll explore those in a second. But essentially, the whole of the spine does pretty similar things. So it contains and protects your spinal cord and the nerve roots. And we've had a look at those in detail over the last few weeks. So spinal cord, we've had a look at in a lot of detail. We did a whole session just on the spinal cord, and then how those little rootlets come off and then come through the intervertebral foramen, which are the side holes, which we will have a look at that in a bit more detail in a sec. So as the spinal cord goes through that hole in the middle there's a gap on either side where the peripheral nerves comes out, or the nerve roots come out. And we had a look last week at disc herniations and the type of either mechanical or chemical irritation that can potentially cause symptoms, especially in the lumbar spine. Don't tend to get it so much in the thoracics in terms of nerve root compression, but you may get some other conditions. And we had a look at something called dermatomes, where a peripheral nerve supplies the sensation to the skin over a certain area. And in the thoracics, common complaint of those intercostal nerves, so the nerves in between the ribs, is something called shingles. And we had a look at that a few weeks ago as well. But as we go through the weeks, we'll explore those in a bit more detail. So the spine as a whole obviously supports your body weight, and because your body weighs less, the higher up it is because it's got less mass. The vertebrae are smaller at the top, and then they're a lot bigger at the bottom. So if we have a look again, these are, I don't think these are from the same person, but there's a thoracic, and if I just get that there's a lumbar. So you can see the two side by side. So obviously this one would be stacked on top of the lumbar below. So the lumbar vertebra, the body is very big. The thoracics, because you're not having to bear all that weight, it doesn't have to be so big. But there are some other key differences with the thoracics that we'll look at. The curves of the spine allow weight to be distributed so that the muscles can work most efficiently. So there is an element of absorption of forces through the spine and redistribution of those forces. So if you think about the spinal column and have a look at the picture just here, so the spinal column as a whole is bent inwards by your neck. We call that a lordosis. Then it comes out around the thoracics, which we're going to have a look at today, and that's a kyphosis or kyphotic curve. Then it goes inwards again, usually. This is it's not everybody that this happens on. Then it usually comes inwards, and that's a lordosis. And then it comes back out again, like a kyphotic region on that sacrum. So we've got these curves in the spine, but saying that, it is completely normal to have different types of curves. So you might have a flatter lumbar spine, you might have a flatter thoracic, and it's just the way that you are built, or it's your adaptation to whatever thing you do for a daily living or as your sport. Okay, so your body can adapt to positions, and your spinal curves may and the joints may be different depending on what you do. Okay, so that it's not necessarily a bad thing for someone to have a flat thoracic spine or a flat lumbar spine, and it is certainly not related to pain. Okay, there are plenty of people with a very flat thoracic spine and they have no pain whatsoever. Okay, so it's not necessarily a bad thing. The joints and the way that the joints are all stacked up, they allow freedom of movement. There's a disc in between each of the vertebrae. We'll look at that next week. And we went into it in detail in the lumbar spine because of the kind of importance of the discs in that region. In the thoracics, the discs are a lot smaller, again because they don't have to be as big, because they're not bearing, those joints aren't bearing as much weight. Shock absorption or shock distribution from perturbations, so basically movement from the external environment. So whenever you take a step, whenever you push something with your arms, then the force is distributed through your spine into the soft tissue structures as well, and provides a surface area for muscle attachments. And I talk about this quite a lot because your muscle attachment points will feel different depending on who you are. So if you have repetitively done a specific movement throughout your life, then the muscles in that region will develop, because they will need to cope with whatever it is you're trying to do. And the bony attachments of those muscles will be different from person to person. So they may be more bumpy on one side compared to the other. Completely normal. Okay, so that's another normal finding as well. So I'm saying that a patient has a flat posture doesn't affect the efficiency of their muscles. There will be certain postures that lend themselves to certain activities. So, and that's just the way that we are built. So, for example, if you're very kyphotic, and that is just your natural posture, then you will relish sports that involve flexion, because you suit that kind of position. If you try to get them to exercise in an upright position, then you'll see today, especially in the thoracic spine, you can approximate the facet joints, which may start to irritate those joints in that position, and they just find it uncomfortable to exercise in a perfect posture. So there isn't any perfect really, and the body adapts. So the best thing I can suggest is to find the most comfortable position to exercise in. So if you're if you're doing a specific movement, like you're doing an overhead press or something, and you're very kyphotic, and that's just normal. If you bring someone back up into a more extended position, that can actually be worse for that particular individual. So we just adapt. And a classic example that I use all the time is Usain Bolt. So he has a scoliosis in his spine, and he's also got very pronated feet. But you wouldn't want to change his technique, and his muscles work perfectly efficiently. So there is no such thing as ideal, and everybody's different. So you go. So these are the differences in your vertebra. So we have had a look at these. We're going to have a look at these today, and we're going to have a look at those once we've done the thoracics. So the lumbar spine, when we looked at that, they have a short horizontal spinous process. So this sticky out bit at the back is a lot shorter, and it basically goes straight out. So when you feel someone's lower back, you can feel a very chunky spinous process, and you should be able to feel that quite easily. They've got a large vertebral body because of the load going through the vertebral, that particular region, and they've got very large, thick facet joints. So the facet joints, we will have a look at this in a bit more detail in a second. I'll just switch back to this screen so you can see it a little bit better. So these, get this the right way around. So that's a lumbar. And these here, so those ones there, these are the facet joints. Okay, so these are the superior facets or the superior articulations, and articulations just means a join. And then these are the inferior ones just here. So if you imagine there's another one on top of that, then the inferior ones on there would attach to these ones. Okay, so these are very, very thick when you compare them to these, and this is a thoracic. See the difference in those? So they're very, very thin here, and I don't know whether you can see it just about there. Yeah, so they're very, very thin. The shape of them is very different as well. So if we just go back to that PowerPoint. So here, the facets are straight down. So these joints, just switch back again. So the lumbar vertebra, because of where, if you have a look there, so if you imagine another vertebra in between there, they are very good at going into flexion and extension. But when you have another vertebra on the top there, they don't rotate very well because the facet joints will bang into each other. Okay, so there is very limited movement into rotation in your lumbar spine, and I've got a really good paper that illustrates that, some biomechanics paper. So the lumbars are very good at flexion and extension, but they're not very good at rotation. I say not very good. The design of them is limits the rotation available. So you'll get about 2 to 3 degrees of rotation in the lumbar spine. Whereas the thoracics, I've got a couple of these, so I can slot these on top of each other. You can see there, so they can glide across each other quite nicely. And the orientation of the facet joints mean that they can slide into flexion and extension as well. The only problem is with these, again, say problem, the only difference is the movements are limited by the things that attach onto it, which are your ribs. Okay, so your ribs will limit the movement from your thoracic spine. If there were no ribs there, then you would be able to flex and extend really, really easily. So if you think about that in the lumbar spine, obviously no ribs, and because of the shape of the joints, you can bend right forward, and a lot of that movement will come from the lumbars. There will be some flexion and extension, so bending forwards and bending backwards from the thoracics too, but because of the rib cage, it will be limited. So you'll get more rotation from the thoracics, less flexion and extension from the thoracics because of the structure. Okay, so the structure will definitely dictate the type of movement that is available. So if we have a look here, so the thoracic spine, you've got long spinous processes. So you can see the long spinous process just there compared to the short flat one just there. Larger transverse processes, so the side sticky out bits. You have a look at that one, that's a thoracic. compared to that one, which is a lumbar. Yeah, in fact, that's quite big for a lumbar. But these are a bit bigger, and the reason why they are these transverse processes is because the ribs attach onto them. Okay, and you don't have rib attachments on the lumbars. The costovertebral and costotransverse areas, so those joints, have facets. So they have joints as well. So let's break those words down. So costal, remember, means ribs. So we've got a join between the rib and the vertebra, and we'll have a look at that in a second. And then the rib and the transverse process, which is the side sticky out bits. And again, we'll have a look at that in a bit. And look at the angle of the joints. Okay, so the angle is very different here compared to here. So lumbar spine, great at bending forward and back, not so good at rotation. The thoracics, okay at bending forward and back, but limited by the ribs, but good at rotation because of the orientation of those joints. Okay, so hopefully that will help to make things make sense. So we've mentioned some of these already. Rotation is where you rotate your body around. Extension is where you bring your body backwards. Flexion is where you bring your body forwards, and then lateral flexion is a side bend. And again, side bending in the thoracics is going to be limited by your rib cage. Okay, so that will restrict the availability of that movement. Cool. So let's have a look specifically at the thoracic spine then. So it has a kyphotic curve. So remember that curve forward, that's usual. Okay, I say usual rather than normal because there isn't really a normal. Everybody's slightly different. There are usually, because there sometimes aren't, 12 vertebrae, and they are usually paired with 12 ribs. And again, I say usually because you can have ribs in your neck as well, and we'll have a look at that when we get to the cervicals, and that can cause some problems. So let's have a look at the features then. So we've got, just get rid of that so you can read the rest. So costovertebral joints, so the join between the superior and inferior costal facets of the thoracics, so remember that TX, and the ribs, and we'll have a look at these now. The costotransverse joints, which articulate or they join between the transverse costal facets, so side rib joints, okay, of the thoracic spine, and the posterior surface of the ribs. Right, let's just break that down and have a look at all of that. So this is a thoracic vertebra. So it's got a small body just here. It's got a hole here. That's where your spinal cord goes down. That bit there is a transverse process, as is that one, and that there is a spinous process. And these little bits here, so this is the body, these are the little feet, so this is the pedicle, okay? So the pedicle forms an archway all around the spinal cord in the middle, all right? This area here, which we'll have a look at in a second, is called the lamina. And that will become really important when we look at the ligaments. So let's just run this video through, hopefully, if it is playing. Is it playing? Well, that's a bit bizarre. Let me just switch to that one. Okay, let's try that one. Ah, beautiful. Bear with me a second. In fact, I can just talk you through this one. So let me just pop that one there. Yeah, so there we go. So there's your spinous process. There's your transverse process, side sticking out bit, and the vertebral body just there. Let me just grab that video for you. Jump that up there. Bear with me a second. Okay, so hopefully looking at these videos will help things make a bit more sense. Fingers crossed. Just get rid of those. Here we go. Okay, so just going to rewind that a second. There we go. So there's your vertebral body, spinous process at the back, transverse process at the side, and then the bigger bodies are further down because of the load going through those areas. So they obviously all stack up on top of each other, and then your ribs attach into there. So the ribs are obviously unique to the thoracic spine. We don't, well, apart from the cervicals, so they're usually unique to the thoracics. And this is these are some of the important bits that we're going to get to here. There we go. So the rib attaches to the transverse process. So that's the side sticky out bit. Okay, so that's one of the reasons why it's shaped the way it is. So there's the front of your rib just there. There's the transverse process there. And can you see that little dip there? Okay, so if you imagine as your ribs move, there is a join on that transverse process to help those ribs expand and move. Okay, and then there's a couple of little joins on the vertebra as well, and especially in this middle section, because you've got different rib shapes depending on where they are in the thoracic region. But in this region, which is the middle section, you've got a little join on the vertebra above, so that one just there, and then another little join just there on the vertebra below. And when we look at the ribs in a bit more detail, we'll have a look at that. So the ribs attach onto the vertebral bodies, and then they attach onto the transverse process at the back. So you can see that there. So there's the attachment on the body, and then that's the little facet joint on the transverse processes just there. Okay, so your transverse processes stick out to the side, and they stick out more than in other areas of the body. And that is the best way to remember the shape of the spinous processes in the thoracics. So if you remember that they look a bit like a witch's nose, so the spinous process points downwards. Okay, and this is really important when you're trying to locate areas. You can never be really specific with where you are in really any part of the body, to be fair, because there are lots of anomalies with the anatomy. But if you have a look here, so say that is T5. I don't know whether it is, but let's say it is. That's T5 and that's T6. So when you feel you count down the spinous processes and you go T5, T6, look where T5 is. It's in line with T6. So when you push on that vertebra at the back and you can feel that bony lump on the back, you're actually not in line with the vertebra that it belongs to. You're in line with the vertebra below, and sometimes it's a couple of vertebrae below, depending on the size of the spinous process. Okay, so if you think you're on a certain area, you might not be. So if you think about this, so if you press here and then come across, you're actually on the rib below. Okay, so if you push on the spinous process and then move to the side, you're actually on the rib that's attached to the vertebra below. So if that's T5, that's T6. So if you imagine rib 6 will come out of here like that, that's the T5 spinous process. You come off to the side, you push in there, and that's the attachment of the T6 rib in this particular individual. Okay, so and it can be different because the spinous processes can be shorter, they can be longer, the vertebral bodies can be shorter, they can be longer. So there's all these variations where if you did an assessment and then I did one, we may disagree on the area that you think you're palpating. If you do it and then you do it again, you will always think it's the same area. Now you may get the same place again on the next time, but it still might not be the right area. Okay, whether that matters or not is another topic of discussion. But the reliability of palpation and being able to fill these areas between people is quite poor. Okay, so that's inter-rater reliability is quite poor. Intra-rater reliability is usually better. However, the validity, so what you're feeling may not be what you're feeling. Okay, so you might get the same spot again and again, but it might not be the one you think it is. Right, so there's lots and lots of variations with this anatomy. So you can't always be certain when you're saying things. So the facet joints, those are these ones here, and you can see the join there. Okay, so the lower joints point forward, the upper ones point back, and that area there, that's the facet joints, and you can see the orientation of those joints. Yeah, so they're like that. So they can glide across each other in rotation, but they can't slide across each other. Well, they can, but they're limited by the ribs. All right. So when we add the ribs in a second, you'll see that. Okay. So those are the features of the thoracics. So you can see all the different bits on there. So this is what they look like in the books. Just move me out of the way. So there's your vertebral body. So we've just seen one of those. We've got a superior costal facet. So superior means above, costal means rib, facet is a joint. Okay, and if you have a look at this vertebra here, it's not like this one. Okay, so can you see that transverse costal facet? So this is the side rib joint. So that's quite circular. Yeah, and there's a section of the rib that attaches into there. This one here and this one here, they're what we call demi facets, so half facets, because when the rib attaches into there, it will half of it will attach on that bit, and then the other half of the rib will attach into the vertebra above. So it kind of straddles the joint. Okay, so the rib straddles the joint, and then it comes around onto the transverse process. So where the rib attaches, it will be bottom half of the rib will be there, and then top half of the rib will be on the vertebra above. Okay, so if you imagine there was a rib here, the top half of the rib would be attached into this section just here. Yeah, so that is the superior costal facet, that one, and that's the inferior costal facet. That isn't the same for every single thoracic vertebra. Okay, the section in the middle, they're like this. Above and below, they're a little bit different, and we'll have a look at those in a second. But first of all, we'll just do the middle ones. So this transverse process here, so the side sticky out bit, that's got a little face, so that's got a little join on there. And if you imagine the rib being here, so it will sweep along there and then around to the front. Okay, so that's where the rib attaches. Vertebral foramen, that's where your spinal cord will go down. You've got a superior vertebral notch. So if you have a look here, it's there. So it's a little bit smaller superiorly, but if you have a look at the inferior one, it's a lot bigger. Okay, so when the two vertebrae join together, it creates a hole on the side, and that is where the nerve root will come out. Okay, and yes, it does look a little bit like a giraffe. Yeah, with the I can get that. That's really good. I like that. I'm gonna have to add that in. And then spinous process at the back. So this is the bit we can feel, but look at the orientation of that spinous process. So if you're feeling here, then you think you're on vertebra number 5, for example, the structures underneath may be vertebra 6 or 7. Okay, so just to let you know. And then so transverse process on the other side, and then you've got the facet joints. So these are the superior facets. So that's that one just there, and that's that just there. So they're the same. And then the inferior facets are these ones. So the inferior articular process. So again, if you've got a vertebra on top of there, that one will join that one. Okay, and then they'll slot together like we just saw on the video. Okay, so that's the main bony anatomy of the thoracic vertebra, but they are different in different bits. Okay, so 5 of 12 vertebra are considered atypical, so not typical basically. So that's T1 and then T9 to T12. So the top thoracic vertebra, and then from T9 to T12 are slightly different shapes and have slightly different attachments because of where the ribs go. All right, so we're going to have a look at that. The most apparent difference between the thoracic spine and the remainder of the spine are the 12 ribs and their articulations. Okay, so those are the reasons why they are a little bit different. Okay, so if we have a look at this, I mentioned this before. So we've got a demifacet, which is a half face. So we've got this here. This is a demifacet here. So a half joint, and then another demifacet here. So if we go back to that video, just scooch along a little bit. So that was that bit just there. Okay, so where the rib attaches, there's a demifacet just there, and then there's another one just there. So the rib doesn't attach in this region to the middle of the vertebral body. It attaches in between the two, so near the disc. Okay, so that's a typical thoracic vertebra, but there are atypical ones as well. Okay, so let's have a look at some atypical ones. So if I just move me out of the way, so we're going to focus on each one at a time. So T1 is this one at the top here. So we've got the superior costal facets are circular and they articulate with the head of the first rib. So we'll have a look at that in a second. But if you have a look here, that facet joint is circular. Yeah, so it's complete, whereas this one is demi. Yeah, so your first rib, the attachment of the first rib on that thoracic vertebra is different to some of the others below it. Okay, so we call that an atypical vertebra, so it's not typical. Okay, the spinous process is horizontal and is long and prominent like C7. So when we have a look at the cervicals, we'll talk to you a little bit more about that. So this is a little bit more kind of sticky out rather than sloped downwards. Yeah, so it's slightly different to some of the others. Yep, absolutely. Yeah, it's coming up. Don't worry. Yeah. So let's go to those now. Let me just show you those. So just been asked for a visual of the ribs. Yeah, so let's have a look at that. So this is a sixth rib. And what you'll see at the in a second is this bit here. So this is the head of the rib, just there. I'm just going to pause that there. So can you see that sticky out bit in the middle there? Okay, so this articulates with the vertebra. So you've got a half facet, so a demi-facet above, and then one below. And if you have a look at the shape of the head, you've got like a lip in the middle. Okay, so the top part of the rib head is curved and the bottom part is curved, so it looks a bit like a point, and that then slots into the gap in between the vertebra, and then you'll have a little joint on the bottom of one vertebra and the top of the other. So those are those demi-facets, and then that bit there, that tubercle, that articulates with the transverse process. So we'll have a look at them in a second. So we'll just add those in now. And then in between your tubercle and your head, you've got a neck. There's an angle, and that's the attachment of the iliocostalis muscle. So it creates a bit of a pull on the bone, and you get a little bit of an angle there. And then there's your costal cartilage attaches into there. We'll talk about that in a sec. But there is a groove underneath. So it's nice and smooth on the outside. Just move me out of the way. There we go. Smooth on the outside. So if you feel your ribs, they're nice and smooth. But on the inside, there's a little groove just there. And that's where your nerve and your blood vessels will go along. Okay. There we go. That's a really nice picture there. Okay, let me just go back a little bit there. Okay, so hopefully here you can see there's a dip there, then there's a ridge, and then there's a dip. So that's where the rib attaches to here, these demi-facets. Okay, so you'll have a dip, then the ridge will fit in between the vertebra, and then there'll be another half facet, so another demi-facet. Let's go back to there. Here we go. So we'll just have a look at that again. So smooth on the outside, then you've got the groove on the inside where the blood vessels and nerves will go, and we'll talk about those in a few weeks. And then when we zoom into that head, two articulations just there. So here we go, there. And that's how it all fits together. Okay, so half facet here, half facet there, and there'll be a little dip in the vertebra of that one, and then a little dip in the vertebral body of that one. All right, and that is how your ribs then move. Okay, and depending on the shape of the rib and the shape of the joint will depend on what the ribs do. So if you remember that rib 1, that had a circular joint, and rib 1 moves up and down, which makes sense because of the shape of the joint. Okay, and we call that a pump handle movement. So it goes up and down. Again, we'll explore this as we look into the ribs in a bit more detail. The ribs in the middle, they move outwards and upwards, and we call those bucket handle. So they come up and then down like that because of the shape of the joints. Okay, so again, the shape of the structures will shape the movement. So this is your rib vertebra joint, so costal vertebra joint. And then this is the joint around the back. So there's your tubercle. So there's a little lumpy bit on the back of the rib, and that slots into that transverse process. Okay, so that's your costo-transverse joint. And there we go. So these are your rib movements. Okay, so bucket handle are the middle ribs. They come up and out to the side. And then pump handle is the top ribs. And that is because of that. Okay, so have a look at the shape of that one. So that's T1. And we'll have a look at the ribs in a bit more detail after we've done the thoracics. But the T1 rib comes up and down like a pump handle. Okay, so remember the old, like pumping water? So it comes straight up, straight down. And it's facilitated because of the shape of the joint. Okay, whereas these, these joints 11 and 12, hopefully you might already know the differences between those lower ribs and what they do, because they don't actually attach into any of the other ribs. They're floaty ribs. Okay, so the shape of these is different as well. Okay, so let's have a look at some of the others. So this is 9 and 10. So if we have a look here, we've got rib 9 and rib 10, or vertebra 9, vertebra 10. So we've got an inferior costal facet is absent. Look at that. Okay, so that superior one is there, but there's no inferior one. Okay, so they don't, in these ribs, they don't attach across the joints. They just attach superiorly, just there. Okay, so there's no demifacet on the bottom of the vertebral body. There isn't on rib 10, there isn't on rib 11, on vertebra 11, and there isn't on vertebra 12 either. Okay, so no inferior costal facets. And also with rib 10, there's no direct articulation with the 11th rib, okay, because usually there is, okay, and there isn't with the 10th rib either, with T9. So usually because it shares a join, you've got a bit shared with the vertebra above and below, but from T9 down, there isn't, okay. T11, so this one articulates only with the heads of the 11th rib, so just there. And the transverse processes are small and do not have articular facets for tubercles of the rib. So have a look at that. Yeah, so that transverse process there is a bit shorter, because what is happening now is the vertebra and the ribs are starting to change because the ribs are floaty in this area. So they're not true ribs. Okay, we call those false ribs. I'm going to have a look at those in a second. So the shape of where they attach is different because of what the ribs do in that area. And then T12 has got only 2 costal facets for the 12th rib. The body, transverse processes, and inferior facets are very similar to lumbar vertebra. So now at T12, it's starting to change from a typical thoracic shape because of the load going through it. It's starting to change into a lumbar vertebra. Okay, so you can see the transition from what looks a bit like a cervical vertebra up here, similar in shape, 12 vertebra down, we're starting to look a little bit more like a lumbar one. Okay, so we can see that change as it goes through. So this is what we've been looking at. So we've got vertebral body just here. There's your rib head attachment. So we've got part attachment on one vertebral body, part attachment on another, depending on where the ribs are. And then as it comes through here, we've got a tubercle on the rib that attaches onto this transverse process. Okay, so if you're brand new to this region, that is a lot of words to get used to. Okay, and it's worth having a look at all of these again. But transverse process, side sticky out bit, there's your pedicle, there's your vertebral body. Okay, and the shape of where they attach will determine what those ribs do. Okay, and we've had a look at bucket handle and pump handle. We'll look at those again in a sec. So the thoracic vertebra, the lower thoracics have larger spinous processes because they're starting to change into a lumbar, and the downward projecting spines overlap each other like slates on a roof, and that's the witch's nose. Okay, so they come across, but then as you get lower, they then start to go a bit more horizontal because they're changing into lumbars. Okay, so the orientation changes. So your typical thoracic vertebra, the ones that are very are usual, they have a ratio of disc to vertebral body height that is less in the thoracic spine than in the cervicals or the lumbars. So there isn't as much disc. Okay, there's not as much absorption in that region from the disc, and that kind of makes sense because of all of the structures around it and the load going through it, the available movement. Okay, so if you think about your neck, you've got lots of movement in your neck, you've got a lot of movement and a lot of load going through that lumbar spine, but the thoracics, because of the ribs and the shape of everything, there's a lot of stiffness in that region. And the disc diameter to disc height 2 to 3 times higher in the thoracic spine than in the lumbar spine. Okay, so the diameter is more, but the height is less. Okay, we've got that acute angular orientation of the lamellae, which is the concentric circles of the annulus, and we talked about that a couple of weeks ago when we looked at the discs, and a smaller nucleus pulposus. Yeah, so the disc is different in the thoracics compared to the lumbars. Yeah, it's taking different forces, so it's a lot more different. So this clinical significance and the movement significance of that is that we've got a lot more stiffness and stability through that region. Okay, hopefully that makes sense. Good. So we've got transverse processes, the side sticky out bits. In the upper and mid thoracic, so T1 to T6, the facet joints are concave, so they cave in. That's the way that I remember that. And they correspond to convex tubercles on the neck of the rib. So there's a lumpy bit on the rib, and then that slots into that transverse process. So that's the bit we've just seen. And then the facet is planar, so it's flat in the lower thoracic region, so from T7 to T10. So there's a lot of variation as you move down, and that variation means that the shape of the lower thoracics allows rib more flexibility during respiration and motion. Okay, so those upper ribs, so kind of T2 down to about T7, those are pretty fixed. The ones below that, they're a bit more flexible, and we'll have a look at why in a second. But that's going to make it easier to move the lower part of our body. But it also makes sense because think about what that upper thoracic is protecting. Okay, so we've got your lungs and your heart, those really key organs in that area, plus a big sternum bone at the front, which it all attaches into to create a real bony cylinder to protect all of those key organs. Okay, so we need stiffness and protection there, but we need then a little bit of mobility, a little bit above, but a lot more below as we get into those lumbars. Okay, so this was the ranges of motion that I was talking about earlier. So this is the paper by a chap called Punjabi. He's written a few books back in 1980, and we always kind of criticize really old references, but when they're biomechanics, they are what they are. So these guys were the first to measure the biomechanics of the spine and the ranges of motion in the spine. So if we have a look here, we've got the combined flexion and extension. So you have a look, this is COC1, so these are movements in the neck. Then you've got thoracics. So have a look at that. This is where it's really interesting. So lots of flexion extension in the neck, in those upper vertebrae, not so much in the thoracics, but it gets more as you go down. And that's because the shape of the vertebra is starting to change into a lumbar, which is where you get most of your, apart from your neck, most of your flexion and extension from. Okay, so your thoracics isn't really, say, designed to flex and extend, especially in that upper part, not as much as the lumbars. You should obviously still have some, but it will be limited because of the structure. Side bending, look at that. hardly any, but more so in the neck because of the shape of the joints in the neck, which we'll cover in future weeks. But look here, as we start getting down into those lower thoracics and then into the lumbars, a little bit more side bend in those lowers, but it's restricted here because of the ribs. The ribs are in the way. You can't side bend as much because of the structure. But have a look at what thoracics are good for. They're good for rotation. Okay, so look, all of that rotation available in the lumbars, but then as it starts to switch into more of a lumbar, into the thoracic, sorry, but as it starts to switch into the lumbars and the shape changes, then the rotation is limited. Okay, so this tells us a really interesting story about where you get your movements from in your spine. Okay, and the reason why you do, or a large reason, is because of the structure. So if you have someone who is very extended naturally, they won't be able to extend anymore through the thoracics because they will be at the end range. However, they may be able to flex more than usual. They may also struggle with rotation because they're in such an extended position, and that's just the way they are. Okay, so that there will be limitations because of the structure. Sometimes you can improve it. Sometimes it's just, it is the way it is. It is what it is. Okay, cool. So that's a bit of an overview, introduction of the thoracics, a little bit on the ribs as well. We're going to, over the next week, we'll have a look a bit more at the sternum and then how those ribs attach into the sternum. And we'll also have a look at the ribs in a bit more detail. So we'll go into the anatomy of those. But yeah, that's basically what we do. So if you've not seen this before, that's how we show things, explain things. You can ask questions, and then obviously you can watch this back and go over it again. So hopefully you found that useful. We do this every Monday, 10 o'clock. So hopefully see you next week. Those of you that are regular, thanks for coming in. And yeah, we're going to do a bit more bony anatomy, but look at the ribs and the sternum next Monday at 10 o'clock. So I'll see you then. Cheers, guys.